Today we have the pleasure to receive André Tchernoff from Laval University. He is one of the faculty members who teach the complication of obesity at the Obesity Summer Boot Camp 2011 at Duchesne, Quebec. So André, there is complications that come from obesity, and that is due to different type of adipose tissue, and that secrete or influence the type of fat in the blood. Could you tell us about it?
The main topic of my presentation is about abdominal obesity and how it relates specifically to a number of risk factors related to obesity. So in my presentation I emphasize that we have studied visceral fat by teaming up with surgeons at Laval University and getting this fat that is very difficult to obtain, and we have tried to study it in quite a bit of detail. And recently we have found that fat cell hypertrophy of these fat depot is strongly related to the risk of hypertriglyceridemia, and this was not found in the subcutaneous fat compartment. In our recent studies, we have found that fat cell hypertrophy in these visceral fat compartment is specifically related to an increased risk of hypertriglyceridemia, which is a recognized risk factor for cardiovascular disease. I also emphasize in my presentation that there's a central role of excess free fatty acid availability in the development of metabolic problems related to abdominal obesity. For example, when there's an inability of subcutaneous fat to trap the free fatty acids, the postprandial free fatty acids that are generated from the digestion of lipids, then there's an overflow which can go to other non-adipose organs and which contributes to the development of metabolic abnormalities, and also could contribute to the development of inflammation related to abdominal obesity.
C'était Paul Boisvert en direct de Duchesne, Québec.